Welcome to the Orlando Injector channel, where we talk all things aesthetics, from injectables to business, complications to confidence, and everything in between. But let's be real, even with my years of experience, I don't pretend to know it all, and that's what this channel is all about. I am bringing you the experts, the pros in their niche that are ready and willing to give you tips and tricks that you can immediately put into action. And I am really excited for our next guest, Dr. Stephen Sorr. Let me tell you a little bit about him, guys. He is a board-certified naturopathic physician and the founder of Source of Health in Scottsdale, Arizona. With a background in functional and regenerative medicine, he has become a respected voice in peptide therapy, hormone optimization, and advanced regenerative treatments. Through his UltraWell Academy, Dr. Sorr trains providers nationwide on integrating evidence-based wellness with aesthetic medicine. Known for blending functional health with cutting-edge therapies, he helps patients and practitioners unlock better energy, performance, and longevity, which I need all of those. So welcome. I'm so excited to have you.
Thank you so much for having me. I've been really looking forward to this interview and getting to know you better and helping with your audience and all this.
Yes. Peptides have become such a kind of hot topic in 2025. I mean, providers like you have been using it for quite some time, but really it's become a household name. I feel like this year is really, ears are starting to perk up. And full transparency, which this is why I'm so excited for this interview, or this conversation, I have very superficial knowledge on peptides. So I am truly here as a student and not necessarily like a colleague or a provider that offers this. We don't offer it in our office. So I'm really here trying to absorb every bit of this conversation. So thank you for being here.
I'm so excited. So we can start off at the top, like super basic, so that everybody can get caught up, and then we'll get into the nitty-gritty.
I love that. So there's so much buzz around the word peptides these days. Can you break it down in just simple terms what peptides are?
Absolutely. So I want you to remember there's the forest and then there are the trees. So we're going to start off with the forest, really like
I love this visual.
Okay. Peptides are chains of amino acids. Amino acids are the building blocks of proteins, but we need to have a slight definition change here. A peptide is just the bond between two amino acids. So a peptide could be 2 amino acids long all the way up to about 50. And once you get to 50 amino acids long, that peptide is now called a protein.
Okay.
That's the only definition change, is like the length of that peptide chain is larger than 50. Now we call it a protein. One of the smallest peptides that we have, that we make on our own, that I know you have used in your practice. You use a peptide in your practice right now, and I'm going to tell you what it is. Glutathione. 3 amino acids. That's a tripeptide. And the key amino acid in there is cysteine, the sulfur-containing amino acid. And acetylcysteine, or N-acetylcysteine, is actually in every single emergency room on the crash cart in case somebody has taken Tylenol, and this is the rescue for it, because it is your body's antioxidant. So you know peptides. You know a peptide.
A single peptide, yes.
There's probably more that you know. It's in your skincare products as well.
Sure.
Copper peptide, it's in there. All of these peptides, they're in your skincare products. You do use peptides.
I know more than I mean, forget about this conversation. I know it.
You know so much about peptides. What are the peptides that everyone's buzzing about? And why are they buzzing about it? And I think that this is where we start to get into that gray area and where people are a little bit questioning everything. Hype is a very strong engine. Hype is a very strong engine, and people get excited, and there's been some recent changes that make people question everything.
There's a lot of misinformation being spread about it. Because it's trending, people who are not experts in the industry are talking about it on TikTok and stuff like that. So I can't wait to get into all of that. Yeah. So we have our basic definition of what peptides are, but how does introducing peptides to your body make you feel better? I don't understand how taking peptides can make you feel better. How do they change the biochemistry of us? How do they make us feel better?
So peptides are a signaling molecule, much like other hormones that we have in our body. But when you and I think of hormones, I think most people think of testosterone or estrogen or even a steroid hormone. These are made out of cholesterol. So the base of steroid hormones is the sterol backbone. So these are a fat-soluble, a very long-acting molecule on the body. When it comes to a peptide, these are water-soluble, just change of amino acids that float around in our body. And we also have enzymes that break down that signal relatively quickly, which is actually really smart. Instead of having a long-acting signal, you just have a little burst from one cell distally all the way somewhere else around the body. So that creates an endocrine function. So some of our glands are endocrine organs that release peptides. Some release steroid hormones. Thyroid is made out of amino acids, tyrosine, so it's a peptide derivative, an amino acid derivative hormone, but not a peptide like we're talking about. Insulin is a peptide hormone. Okay? So it's not as foreign as most people think. But what has come to play is that it's like your iPhone. It's like, oh, there's an app for that. There's a peptide for this. There's a peptide for that. And these are like single keyword or keynote things. You're like, oh, if you can't sleep, take this. If you have anxiety, take this. If you have this, take this. If you want libido, take this. Like, that is what is the problem. It's that whisper down the lane where people are just thinking, oh, I could just download that app and get it. Yeah. But you're an endocrinologist at this point. You're playing with fire, and somebody's gonna get burned.
Yeah, you're so right. It should be treated as like true medications. I think people are minimizing it or simplifying it too much, and it really needs to be treated like a medication. And if it's right for that particular patient, and not necessarily what medication works for you isn't going to work for me. So I think we need to treat it like that versus some like TikTok trend. And I think that's where things can become really dangerous.
So when it comes to the world of peptides and why they're available the way that they are, is that there is proof of concept. So in science, we want to study things. So if there is a peptide that's either homologous, analogous, or somewhere like our body, if we apply that to a cell in a petri dish, do we get a response or do we get a tissue response? Then there are animal models where they give these peptides to like a rodent or a rabbit or something and see what the result is of that. The murine model or mouse studies are simple because mice live for about 2 years. So you can really study things with that. But mice are still not humans, so you can't completely translate something in a petri dish to an animal and then to a human.
Right.
So when we say there's a peptide that's going to help you live longer, can you please prove that? Because we haven't seen that to be true. There are peptides that, they're going to make your telomeres longer. And what is the human randomized placebo-controlled trial on that? We don't have it. Right. Is there enough evidence to prove that it is efficacious? Don't know. How about safety? Also, I don't know. There are peptides that have made it through FDA trials, but then they fell short. Or there's one that does better. So it got put aside because it's not as good as the best of the best. Then there are some that have gone through and they had horrible side effects or potential risks, and they were pulled. But people are like, hey, I know this peptide. I can grab this and use it because it can do that, with ignoring all of the other things. So in medicine, we are in healthcare, okay? And we take an oath to first do no harm. And our goal is with safety, number one. Always think about safety with anything. The next is efficacy. And this is where pseudoscience comes in. I can give somebody a sugar pill, a placebo pill, and people will feel better. So the placebo effect is a very strong effect. It's like upwards of 30%. 1 out of 3, that's a win. People will feel a difference, and that's just out of placebo. Now, when we're talking about peptide usage, there's different routes of delivery. We have oral capsules or peptides that you can take orally that go through the GI. We have ones that you can apply topically, which is like in our skincare. But there are injectables, which is where this conversation is most likely leaning towards, is the injectable side, which obviously introduces a different layer of risk because there's no concern with that barrier. You pierce through it. There's also nasal and sublingual or troches where you can absorb it through the bloodstream that way versus swallowing it.
Why have those 4 peptides become so popular in the media? Is it because they have more clinical trials behind it? Is it because they have more results? What has made those 4 in particular take off?
Pain points. People have issues with their tissues. They're having difficulty with the aging process. They're having difficulty not seeing their recovery as well. And this is where these come into mind. So BPC 157 I think is a wonderful peptide to start our conversation. So let's kind of get into what that means. BPC is made in our stomachs. It's a gastric peptide. It stands for body protection compound, okay? What this does is it helps the tissue build more blood vessels to the area. So angiogenesis stimulates the healing process. Do we want to always be stimulating angiogenesis? No, you don't. And what if something else was growing and you give it a blood supply? Enter risk. So it is a gastric peptide. There are oral capsules that are wonderful of BPC 157 that you could take orally if you are having like a peptic ulcer where there's damage, right? That's kind of like its main function. It's meant to do that. Or if you eat like a seed and it kind of cuts you on the way in the inside, like this peptide is meant to help heal and direct healing to the GI. That's its main function. When you apply this outside of the GI via an injection, you can help the systemic effects of VEGF, or vascular endothelial growth factor, helping the blood vessels grow. So that is promising. It is something that might tickle people's fancy, but I don't think that's something that people should be taking in perpetuity. If you're trying to heal and recover from something, that makes sense. Okay?
So specifically you're saying, for example, my husband has tendonitis in his elbow, just as a simple example. Would you say that would be beneficial for somebody like him who has inflammation, something going on in a specific area? I've seen on TikTok, and he's never done this, but I've seen on TikTok that people inject it directly into the elbow to target the elbow and the inflammation around the elbow. Is that legitimate? Is that real? Is there evidence behind that?
Phenomenal question. So let's talk about tennis elbow, just as a quick pathophysiology lesson. If it's been hanging around for months and months and months, which a lot of people have tennis elbow that lasts for a long time, called lateral epicondylitis, it's actually not an itis at that point. It's an osis. It's painful. It hurts them, but there's no inflammatory cells, which means it's not acute inflammation.
Right.
And the way to heal a chronic inflammatory condition is often with a little bit of acute inflammation. I think if you're doing it directly into that site, the needle is doing more benefit because you're stimulating that healing process. So
it's almost like an acupuncture.
Exactly, or dry needling. I prefer wet needling, so that's where PRP has come in, and I've been using PRP for over a decade in clinical practice with ortho. I do ultrasound guided injections directly into that inflamed or thickened area where there's tendinosis, or there's what it's called an enthesopathy. Not to blow away people with vocabulary, but basically the insertion point of that tendon onto the bone is called the enthesis, and it's being pulled away. So every time that muscle wants to contract, it's losing that grappling hook, and you can't even lift up a fork.
Yeah.
It hurts. So we need to stimulate that body to heal in that area. So I think there are other regenerative therapies that need to be done in pairing, in conjunction, or that will precede something like a peptide like that. It does show benefit, okay? But if it is currently inflamed. So we have shockwave therapy where we're creating micro traumas to the tissue because it's been there, it's chronic. So this is where we're coming into how to treatise somebody and what's a therapeutic order. So if they keep playing pickleball or something and hurting themselves, I need them to stop doing the pickleball because that's what got them into trouble in the first place.
So to the person on social media that is saying, have an acute injury, I'm going to take BPC 157 to help that, what would you say to that in 2 sentences?
Number one, I would ask them, how well do you heal on a normal basis? If you heal fine, then why would you add that in there? I think you're just pouring water on your face, but you're already in the pool.
Okay.
If there's incomplete or ineffective healing, then we want to reinstate that. So let your body do its thing. You can stimulate and support the healing pathways, but people get a little bit overzealous with things. More is better.
They think it's a miracle drug, and it's not.
So CJC 1295 is often paired with another peptide called Ipamerelin. So these two are working in the hypothalamus, the computer processing unit in the brain that's sensing. And what this does is it's injected always in the evening right before bed. And that helps to catalyze the release of growth hormone from the pituitary gland to then upregulate IGF-1, insulin-like growth factor 1, in the evening. This is naturally released as we initially go to sleep under certain good conditions. So if you have poor sleep, we can then extrapolate that perhaps you have low IGF-1 levels. But guess what? We can test that. So when I come to ask people if they want a peptide, I'm like, will you please do some blood work to precede that to see where you are as a baseline? Diagnose before you treat. Have we lost all sense of clinical medicine?
Yes.
How can you make...
Yes.
Yes, we have. The world
The
has
answer is
lost
yes.
time. Right. So that's where I come in to just zoom out, touch grass, find the forest again because you're lost. If it is reasonable and prudent, if we do the proper diagnostics beforehand, then we can see who does not like a before and after picture. Everybody loves a good before and after. So when I take a look at your blood work, I want to see where your baseline is. Then I want to install a treatment and then measure the effect of that treatment. This is the simplest science experiment ever. Before and after.
So why has this one become so trendy in particular?
Well, because it is a wonderful tool. A lot of people have poor sleep hygiene. They don't get good quality sleep. And that means that that first 4 hours of sleep where you are regenerating and healing is impaired. So you don't recover from your workouts like you used to. You're not recovering as well. And growth hormone is a wonderful tool. Wonderful tool. It is illegal to inject people with human growth hormone unless you have a growth hormone deficiency. But this is a peptide that signals to the brain to release growth hormone. So you're not giving growth hormone, you're giving the release to release growth hormone in small dosages. Again, if it's going to make something grow, again, we're thinking about cancer risk. I don't want to accelerate a tumor growth.
And that's been the downside that we're seeing on social media.
That's the pushback. That's the pushback. There's a
pushback.
theoretical risk. There's a theoretical risk.
And so when you are choosing patients to initiate peptides, are you having this conversation with them?
Yes, patient selection is key. If the patient wants a quick fix and they're going to ignore the basics, the foundations of health, I'm not going to play their game.
I don't know what has happened to our industry as a whole. As in aesthetics, it feels like the patients have become the drivers, right? Like they come in and say, I want this. And as providers in aesthetics, we have just shifted towards like, okay, we'll do that treatment. But in reality, we need to diagnose them and treat them with the appropriate things. And the control has kind of shifted because our patients are coming in so informed these days. So for the patient that's coming into your office saying, I want to be on these 3 peptides, are you like, whoa, whoa, whoa? That's not how it works here. We're going to do lab work. We're going to really diagnose you, and we're going to determine which specific peptides are actually going to benefit you versus you coming in with these top 4 that I just mentioned.
Sure. I mean, thank your drug commercials for ask your doctor about blah if it's right for you. This is literally what drug commercials will do. Ask your doctor if this medicine is right for you. And think of it exactly the same way because the population has been conditioned to that behavior. So you say, okay, if you want that medication, I am going to go through my diagnostics and say, this is the most likely diagnosis. We're going to confirm that or rule it out with a test of some sort and then initiate treatment. Our treatments are always least invasive to most invasive, but people have this tendency to want a quick fix, a pill for every ill. Now there's a peptide for every ill. Again, I'm going to take a bit of an ethical and moral high ground as a physician who is practicing medicine respectfully and within a scope of practice that makes sure that people are doing things correctly and that are healthy, holistically. I want the person to be okay. Yeah. On that note, where someone is coming in and saying, I want this, or I want lip filler, I'm like, your lips already walked in the room before you did. We need to learn how to say no. This is ridiculous. Ridiculous. So I am not an order taker. I don't work at a fast food store. I want to think of myself as fine dining. I know the menu inside and out. I know the wine list. I know how to pair everything together. You tell me what you're interested in. Do you want to go more of a light fare today? Do you want to go a little bit more earthy, hearty? You want you're really hungry? Or how would you like to pair that together? And let me guide you through my menu that I have to present and offer to you. So that way you leave here feeling amazing. I want you to feel better. I want you to look better. When you look in the mirror, you feel confident. That's what we are selling, if you will. But we're doing this through this medical lens. And I don't think that everyone's on the same page with you and I, Alexis. I think that we have a lot of this commoditization. This is insanity.
I agree. I wholeheartedly agree, and it has been such a landscape shift in our industry, and it needs to stop, and we need to go back to being medical providers and not just like I feel like 7-Elevens where they just walk in real quick and grab something and then off they go. Like
Yeah.
it's become I'm happy that aesthetics has become accessible, but it's become a little too accessible, and
Yeah.
it's losing the medicine, and it's becoming just like these little like drive-throughs.
It's the cash grab.
Yeah, it's
People
pretty
come
sad.
in, they're like, I want this, and you're like, this is expensive. They're like, I want it, and you're like, cha-ching. The art is in the restraint. You
You're
need
so
to
right.
learn how to say no. This is art, okay? You don't go and buy paint and all of a sudden you're an artist.
God. Yeah, you're so right.
So, how much for a syringe? I'm like, the syringe is a cotton ball. Do you want a cotton ball? It's how I use it. It's not the product, it's the person. And I apply the same concept to when I practice medicine, internal medicine, endocrinology, all of these things, like I do with aesthetics. I am the deal, nothing else.
And I think with peptides, I feel like the speed at which the danger is coming on is faster than filler and neurotoxins. I feel
Yep.
like overnight people have called themselves peptide experts,
Oh, yeah.
and they're going to really do some harm to patients. Like me, I am the first person to say, I know nothing. That's how I started this conversation. I know nothing. I'm here as a student. It is very, very little that I know about peptides, but I want to learn and I want to know more and I want to be able to have conversations with my patients. But I am in no way ready to start offering this service to patients at the knowledge level that I am. And that's because I have no ego when it comes to my patients. I'm not just going to offer a service because I can start making a few thousand more a month. That's not what it's about. I think this whole landscape shift in aesthetics has become really, really dangerous.
I completely agree.
GHK-Cu, the copper
I
peptide
love
that
this.
I'm hearing about.
I love this one. So GHK-Cu is copper peptide, and that's been in our skincare products for a very, very long time. And it works very, very well. GHK are 3 amino acids. There's an amino acid code for everything. Okay, so there's GHK, there's KPV, there's AHK because GHK is now off the FDA approved injectable list. And then the Cu just means copper. Okay, this is a wonderful peptide that gets absorbed through the skin. You can put it on the skin or in the scalp and you will get an effect. 3 amino acids is very small. To pierce through or get through the skin, you need something that is smaller than 500 kilodaltons. That is a very small molecule, and 3 amino acids and a little copper ion, pretty tiny. Easy to do. So what that does is it helps to shuttle and coordinate the extracellular organization of collagen. So it helps with the tissue repair, maturation, and remodeling process in neocollagenesis. Everything that we do with lasers, microneedling, all of our biostimulators are generating fibroblasts to actively produce collagen. Collagen is spit out, and it is outside of that cell where the organization of collagen happens to go together. There are other factors that go along with that. If you want to go down a little biochem brain on neocollagenesis, please tempt me with a good time, why don't you? I love this biochemical process. It's fascinating, and you'll see this in a lot of skincare products and supplements galore. So I think that GHK-Cu is a wonderful peptide to incorporate into a topical preparation that you can already have on the shelf, ready to go, not expensive, or it could be compounded at a compounding pharmacy with some of your other favorite goodies that you want to put into someone's skin. It's
So
the
from an
injectable that has been
injectable,
taken off.
yes, the injectable.
Because of, again, it's not just collagen, it does help on that angiogenesis pathway because blood vessels also contain collagen and that growth formation. So, cause for concern. More research is needed for some of these peptides. So, prior to the FDA coming in 22 and pulling this list of peptides that we can't get, it's so interesting that after the FDA pulled them, now everyone's interested in them. It's like when you take away something from a kid, they want it more.
Yeah,
Is
they're
that
playing
what,
hard to get.
doesn't it? It's so funny that adults are acting like little toddlers again. You took away my favorite toy. I want it more. I can't stop thinking about it. That's what happens. We have rules because someone broke them, and this is why we can't have nice things. So
This is why.
this is why we can't have nice things. So We're talking in the aesthetics industry, okay? In this field of medicine, it's a field of medicine, it's not an industry, okay? We can use good dermatology practices and use GHK-Cu topically and get the result that we're looking for. We don't have to do anything more than that, really.
I love that. That
So
pretty
that's
much
an easy one.
summarizes.
Yeah.
That pretty much, yeah. So tell me about PT 141.
This is a good one. This one is great. Can I tell you first a story about how they identified what Viagra was really good for? Viagra was originally designed as a vasodilator to help people with angina, to help dilate the blood vessels of the heart so they can get more oxygen. Within a few minutes, like, whoa, actually, there's a different effect. I think we're going to roll with that one because it wasn't very good at lowering blood pressure or doing that for the heart, for angina, but it did cause some other vasodilation and swelling in other areas. So this is one of these, we have an intention for this, but also kind of does something else. So
Little miracles.
I know. And I could do this with where drugs come from naturally in nature. I think it's just a fascinating little trivia question. But PT141 is a branch, a little piece off of a larger peptide that makes us tan called melanocyte stimulating hormone, alpha MSH to be specific. So on this big protein, peptide called alpha MSH, a branch of this does something for libido. It stimulates what's called the melanocortin receptor. But if you just give somebody MSH, you get tan. So people have used this to get tan as like the tan and glow Barbie peptide. But there is a big risk with anything that stimulates melanocytes. Alexis, please tell everybody about how melanoma just can pop up out of nowhere. That is a deadly cancer that I don't want to play with. Very, very dangerous, actually. PT141 is named bremelanotide, B-R-E, melanotide. It is an FDA-approved medication for women who have hypoactive sexual desire disorder, HSDD. It's an approved medicine at a regular pharmacy. It could be a nasal puff, a little nasal spray. It doesn't have to be directly injected. That's nice, but gotta go blow my nose or powder my nose. Like there's just some comfortability. It comes with some side effects too. It can give you a wicked headache, and that's uncomfortable as you're trying to get in the mood. Now you've got a pounding headache. Same thing can be said with any of the vasodilators like Cialis or tadalafil.
I was gonna say, I think it can cause flushing, like a huge
Yes.
wave of flushing, right?
And just think of like how an orgasm kind of creates that flushing feel too.
Yeah.
So, and that could be uncomfortable and unnecessary for people. It is approved. It is something that can be prescribed, covered by insurance with the right diagnostic criteria. But again, people will take that and run with it.
Right.
But it's approved for women, it's not approved for men, and most likely we're going to see men using this. And I've had men, I put them on this, and varying degrees of success. It's just annoying to want to have to inject it and then go.
So, of those 4 peptides that we just talked about, which have you found truly the most success where you've actually seen your patients transform and come back and feel so much better with whatever they're targeting?
Honestly, it's the growth hormone secretagogues. I find that those are wonderful. And CGC-1295 is only one of them. There are a few other ones, and they have promise, they have merit, they actually have really good science to them. But it has to be in the right person, and again, the foundation is everything. If somebody is a hot mess, I'm not giving them a peptide. I'm just not doing it, because they have not done the things that are actually going to get them more bang for buck. And it's so much more expensive. So let's say a guy's coming in who has low testosterone and it's truly low for whatever reason, and I prescribe him testosterone. That will do more for him than the peptide. And it's way less expensive. Way less expensive. So again, I'm not here to just make money off of people. I'm here to prescribe something that's going to get people the best result possible. That's what I promise to my patients. I'm authentic, and I'm not going to change that. Tesamorelin is approved for people who have lipoatrophy, like HIV-associated lipoatrophy, where there's difficulties in their fat distribution, and it builds muscle back up. It helps to reinflate the body, but it's redistributing where that compartment is. So it can help with belly fat. I hate saying these words because it just makes people want them more. That stubborn belly fat, that visceral fat that's inside, all of these words. But imagine just giving somebody a peptide because they want it like I'm at a fast food place, and not telling them about strength training and nutrition and sleep and stress management. That has to precede it. You can't just do the peptide without doing the work and putting it into there. Medicine's very simple. Either take something or do something, or take something away, which is harder. Removing something from somebody's habits are harder than adding in something new.
Yeah. Have you seen success with that particular one?
Yeah, we do body composition testing here at the office. I found that adding that in removes patient doubt. They stand on a scale at home. I'm like, I don't care about your weight. Top of his game, Arnold Schwarzenegger was morbidly obese according to BMI standards, height, weight ratio.
Right.
We don't use that. What's your muscle? What's your fat? Where's your visceral fat? What's the hydration status in people? This is how body is composed. And if we're out of that balance, we know how to work on that with simple, effective things that are evidence-based, very strong, human, randomized, controlled trials. We know what works.
So our GLP-1s are technically considered peptides, but for some reason they're in a whole other category by themselves, but they are under the umbrella of peptides. Why have they been positioned in their own category? Is it because of FDA approval, or because they just have the GLP-1 name has become widespread? But they're peptides just like all of the other ones we just discussed, right?
Absolutely. I think you're right on both of those counts. The FDA has an approved medication that is revolutionizing healthcare at an alarming rate. It is very, very powerful medicine. It is a peptide. Our natural GLP-1, which is a single action, hits your GLP-1 receptor, and because it's a peptide and we have proteases in our bloodstream, that signal is degraded within 30 seconds to a minute. It's a short-acting signal. You eat something good, boop, all right, thank you, we're done. And then it goes away. So GLP medications are originally derived from nature. Do you know where that comes from originally?
No, do tell.
It's actually local to Arizona. The Gila monster, Gila, Gila monster. The venom is hypoglycemic. So when that venom attacks the animal, their blood sugar drops.
That's
so
fascinating.
This was extracted back in the turn of the last century, and it's an approved medicine for diabetes called Byetta, Exanatide. And the way that this peptide is working is it can avoid that degradation by our natural proteases. Where semaglutide started is that it's further modified to resist it. So now you have something that can peak in 3 to 4 days and last about a week versus 30 seconds to a minute. Talk about long acting. When you get to the dual agonist called Tirzepatide, that has activity on both GL and GIP. So both of these are called incretins, which are types of hormones that affect on the GI tract, but also in all of our other tissues like our brain, our heart, our kidneys, the liver, things like that. And muscle to help sensitize insulin, improve satiety, all the good things that it does. Now there's a third one that's in clinical trials that has not been released yet. It's not an FDA-approved medicine. It's a triple agonist.
Retatrutide?
It's called Retatrutide, R-E-T-A. And on TikTok, they call it Ratatouille, so that way that their account doesn't get flagged and taken down. Talk about living in this legalese, outside in this gray zone. If you hear the word Ratatouille, you should be running. It's so unethical. It's so bad. So that triple agonist is currently in trials, and it will likely get approved either next year or the year afterwards. There's another one as well that works on a different receptor that's working with amylin, which is released in the pancreas that affects a different part of the brain that can help with that nausea side effect. So that's being trialed in combination. There's many different now variations of, well, let's put this one and this one together. Let's put this one and this one. Let's do these three. Let's do this one. Let's try something different. They're trying. Billions of dollars have been made already. Like, this is a hot topic. It works well for the right person. But again, I'm going to go backwards. If you are not fueling your body correctly and you just want to keep going down that line that's gotten you into trouble in the first place, we're just putting a Band-Aid over a bullet hole. And that's what Taylor Swift says. And she says, Band-Aids don't fix bullet holes, everyone.